Availability of sanitary material through rural sanitary marts RSM, production centers PC, self-help groups SHG. In many states, good quality sanitary material and hardware are accessible through the market, with the private sector providing such material competitively. In such states, RSM's PCs are not required. However, in a few states, the penetration of sanitary materials in the market is still inadequate. In such cases, states can decide to utilize the provision of the rural sanitary marts and production centers. The rural sanitary mart is an outlet dealing with the material, hardware and designs required for the construction of sanitary latrines, soakage and composite pits, vermicomposting, washing platforms, certified domestic water filters and other sanitation and hygiene accessories. The primary aim of an RSM is to provide material, services and guidance needed for constructing different types of latrines and other sanitary facilities in close proximity to the beneficiaries. RSMs need to ensure that a variety of pans, rural ceramic, HDP, fiberglass are available for the beneficiaries at reasonable rates. RSM should especially have those items required as a part of the sanitation package. It is a commercial venture with a social objective. Production centers are the means to produce cost-effective, affordable sanitary materials at the local level as per local demand suitable for rural consumption. States have to ensure that monitoring mechanism is set up to ensure that the quality and cost of the products being produced and marketed are of acceptable quality. They could be independent or part of the RSMs. The production centers, rural sanitary marts can be opened in areas where they are required and operated by SHGs, women organizations, panchayats, NGOs, etc. Support of private entrepreneurs may also be taken for ensuring an effective supply chain. In all cases, the Gram Panchayats have to ensure the availability of a pool of trained masons whose services can be utilized for the construction of toilets. DWSM, DWSC, GPs should have a memorandum of understanding with the RSMs, PCs, along with a system of joint monitoring evolved to ensure that the RSMs and PCs are on track with the production plans as per requirement. RSM should have a method of quality certification of its products and a band of trained masons and motivators. Quality standards were notified by BIS or by MODWS for each of the items of purchase should be strictly adhered to. This is an important requirement as poor quality products should supplied from the RSM PC can significantly derail the program. An interest-free loan up to Rs 5 lakh can be given out of the revolving fund available with the district in each case for establishing a RSM or PC. Loans from the revolving fund for RSM or PC shall be recovered in 12 to 18 installments after 1 year from the date of receiving the loan. States may decide on the number of RSM or PCs to be set up as per requirement, ideally with one such unit per block. However, large blocks having more than 10,000 population may have multiple RSM or PCs. The RSM or PC will prepare a business plan for each financial year and submit to the DWSM or DWSC for review. Such a plan should be practical enough to provide hardware support, saturating all the villages with IHHLS and other forms of toilets in its areas of operation. The business plan should also reflect sufficient income generation to be able to return the amount to the revolving fund of the DWSM or DWSC in fixed installments. Each RSM or PC should report to DWSM or DWSC every 6 months about its performance against the business plan. The district RALU shall monitor the performance of the RSM or PC and provide feedback of necessary interventions to the RSM or PC and to the DWSM or DWSC. There are an increasing number of self-help groups that have come into being under various livelihood support programs. These SHGs are present extensively in many states. The potential for a sanitation supply chain built around SHGs can be explored and set up by states, which can address the problem of reach given the widespread adoption of the SHGs in the country. States can decide to extend suitable financial support to the SHGs in line with the RSMs or PCs if necessary by adopting suitable convergence frameworks with the parent program. Provision of revolving fund at the district. A revolving fund may be created at the district level out of the SBMG funds. The revolving fund may be given to societies, self-help groups or other groups as decided by the states whose creditworthiness is established for providing cheap finance to their members for the construction of toilets. Loan from this fund should be recovered in 12 to 18 installments. States will have the flexibility to decide other terms and conditions for sanction of the revolving fund. This revolving fund can be accessed by APL households not covered by incentives under the guidelines. Households which have availed incentives under any earlier sanitation scheme can also access such a finance as loans. Those households, BPL and APL, covered under the incentive can also approach for financing under the revolving fund to meet the additional cost of improved toilets with bathing facility. Registered SHGs with proven credentials can approach the DWSM for such funding. Up to 5% of the district project outlay, subject to maximum of rupees 1.5 crore, can be used as revolving fund, including funding for setting up of RSM or PCs. Provision of the revolving fund in a district shall be approved by the DWSM or DWSC and shall be shared between center and state on an 60:40. 90:10 for NE and special category states basis. Microfinancing of construction of toilets. To enable the provision of low-cost financing to individual households for the construction of household latrines and to leverage the network of NGOs and SHGs identified by agencies like NABARD and other financial institutions, in the wake of the need for universalization of sanitation facilities, possibilities of setting up of a microfinancing arrangement should be explored by the states and the MDWs. This will facilitate converging financial resources, management skills and outreach capabilities to cover the demand of toilets for households not eligible for direct incentives under SBMG and or for those households interested to build a more expensive toilet. States and districts may examine possibilities to access credit at the local level to further the financing of sanitation activities, which may be taken up either independently or in convergence with Swachh Bharat mission activities. Such financing can be inter alia through banks, recognized financial institutions or through livelihood programs. Community sanitary complex. Community sanitary complexes comprising of an appropriate number of toilet seats, bathing cubicles, washing platforms, wash basins, etc. can be set up in the village at a location acceptable and accessible to all. Ordinarily, such complexes shall be constructed only when there is lack of land in the village for construction of household toilets and the community or GP owns up to the responsibility of their operation and maintenance and raises a specific demand for the same. Such complexes can be developed at public places, markets, bus stands, etc., where large scale congregation of people takes place. The maintenance of such complexes is very essential, for which the Gram Panchayat should own the ultimate responsibility and the operation and maintenance should be assured. User families in case of complexes specifically meant for households may be asked to contribute a reasonable monthly user charge for cleaning and maintenance. For complexes in places of community congregation, pay and use model may be encouraged. The proposal for putting up CSC will be approved by the State Level Scheme Sanctioning Committee SLSSC. Suitable operation and maintenance and monitoring guidelines may be issued by the state to ensure proper maintenance of the complex. For establishing such complexes in rural areas, the Handbook on Establishment and Management of Community Sanitary Complexes in Rural Areas issued by the Ministry may be referred to. Priority allocation from centrally sponsored schemes for ODF villages. Priority allocation from CSS will be made to reward villages that have become free of open defecation. Prioritization of 14th Finance Commission for improving water and sanitation in rural areas. As the 14th Finance Commission has emphasized on the services relating to sanitation and water, it is imperative that the capacities of GPs are strengthened to help them in carrying out this mandate by sustained hand holding. GPs may be advised to utilize a predominant part of the 14th Finance Commission grants on improving basic services like water supply and sanitation. The GPs could consider setting up and managing projects relating to SLWM, public toilets, providing household connections for water supply and O&M of village level water supply schemes utilizing the 14th Finance Commission grants. The village community includes labour, both permanent and temporary. Section 9 of Plantation Labour Act 1951 stipulates that there shall be provided separately for males and females in every plantation a sufficient number of latrines and urinals of prescribed types so situated as to be convenient and accessible to workers employed therein. All latrines and urinals provided under subsection 1 shall be maintained in a clean and sanitary condition. Hence, there is a provision under the Act to enforce provision of latrine for plantation workers. This provision can be effectively used by the local administration to cover those laborers who are ineligible for incentive under the SBMG scheme. The maximum support as per unit prescribed for a community complex is rupees 2 lakh. Sharing pattern amongst central government, state government and the community shall be in the ratio of 60:30:10. The community contribution, however, can be made by the panchayat out of its own resources, from grants of the finance commission, from any other fund of the state duly permitted by it, or from any other source as obtained from the state, district or GP. For funding CSA or public toilets, states may also source additional funds from CSR, CSO, NGOs for raising the cost of individual complexes. The mode may be public-private partnership, PPP or VGF, which should cater to the needs of operation and maintenance of their facilities. Water supply to these CSEs will have to be assured under the NRDWP before a CSE is sanctioned.